Thanks for staying with us. So there was a trending conversation on social media concerning a bill seeking to curb brain drain by mandating Nigerian medical doctors to practice for at least 5 years before going abroad. Now, this bill has passed second reading in the House of Representatives. It was christened a bill for an act to amend the Medical and Dental Practitioners Act, Cap M379, to mandate any Nigerian-trained medical or dental practitioner to practice in Nigeria for a minimum of 5 years, being granted a full license by the council in order to make quality health services available to Nigeria. Now, that was sponsored by Mr. Ganiyu Johnson, and it's been on the debate on Thursday's plenary, and obviously Nigerians have been talking about it. It's quite hot on social media and various platforms. Nigeria are asking that this is wrong, it's unfair for the Nigerian legal system to stop, or the legislature to stop them from going abroad for greener pastures, even after being trained abroad and trained in Nigeria. What are your thoughts on this? We're going to open our phone lines to hear from you, Nigerians. There have been both sides of the argument. Some have said it's a great deal to ensure that people stay back. Others are saying it's wrong for you to stop or impede people from their growth. What are your thoughts on this? You can call us on the numbers on your screen, 081-270-53687. You can also call us on 091-390-76948. You can also tweet to us at TVC Connect. Please hashtag YourViewTVC so we can read your tweets. What are your thoughts on this? Do you agree? Do you disagree? And why? I'll start with the ladies, and hopefully we can get a few comments on social media so that we can have a robust conversation. Nima, what are your thoughts on this when you heard this? I was sharing with Miriam earlier in the makeup room that I have a brother-in-law who is a medical doctor abroad, and he's doing quite well. He has a beautiful house, has a beautiful car, and, you know, it says when he's with his colleagues, they always just admire, in fact, they envy him. Say, you don't have any loans to pay back. You're just buying houses. You're buying a nice car. How can you afford it? He's like, well, he doesn't have any bills. He doesn't have any loans to pay back. So he's making or any student loans to pay back because he actually got his first degree in Nigeria and did all his medicals here. He went abroad, did the exams, passed, and he's working. He's living the life. What are your thoughts on this?
Thank you for helping my point, but my point is also in the middle. So hypocritical Nigerians everywhere. Person proposing the bill, the Nigerians opposing it. Everybody's being an hypocrite. The Nigerian will study here at a very subsidized rate. Yeah. But when they blow abroad, they forget home. They keep saying, that Nigeria, I escaped. I escaped. Nigeria did not happen to me. And then the politician who is proposing and thinking, because we now have a deficit, whether we like it or not. And if we continue like this in a few years, in 10 years, we just might not have doctors again. Yeah. So with the statistics of a doctor to how many number of patients that we have, there's a problem if they keep going. But then the politician that is proposing the bill, his doctor is abroad. His medical history is abroad. And inside this Nigeria, everybody now want to compel some people to stay when they won't stay. I wanted the bill, because I did not see the entire bill. If that bill had captioned that no Nigerian will also seek medical whatever abroad, it would have really been a relief for me. Because the doctors can be compelled to stay, and if they are also compelled to stay, we will see an improvement. The truth is that in the hospitals, sometimes these doctors have to help out. I don't want to even give details, but when I had one surgery, they were shooting me injection on my spine with the one that was provided for the hospital being substandard. Somebody had to offer within the practitioners that were in the ward at the time to give us one from her private stock that got my... And I could have, that injection for the anesthesia, what's it called, during surgery. It can be crippling for life. And so we know that sometimes they too out of pocket have to assist. Yeah. We know how it's not encouraging with the kind of facility that we have here to practice here. So even when you have the knowledge, your head will just be boiling with the knowledge. You don't have a favorable environment to practice. So when they are doing bill, the bill should be holistic. It should capture everything.
Point taken. Let me come to you, Mariam.
Yeah, so my point is I would just like to read what the national president for the NMA said. But before then, I'll tell you my very first thought when I heard about it. For me, it just came across as almost like an infringement of someone's human rights. That's how I first perceived it. But then I like to also, give people the benefit of the doubt. I'm saying these are legislators. They are, by standard, maybe better educated, exposed than most of us.
Of our government, yeah.
Good. And then maybe they have information that we do not have. So I really was questioning this. In fact, I threw it into my secondary school group, and I wanted like the doctors in the house to tell me, and the doctors do not think, they think that this is not a bill that would even go far and shouldn't even be discussed. But let me read what the national chairman, president for NMA says. He says that, first of all, that everybody who passes through the Nigerian, he said that first it will make it illegal to single out doctors for this, because everybody that goes through school in Nigeria is subsidized for everyone, whatever it is that you're studying. So why are you singling out doctors? So he alludes to it being a segregation or selective kind of bill. Then he also said that he mentioned what you mentioned, which is we have medical tourism.
Okay.
That is where we should be dealing from. We should find out why people are leaving. And if it's for greener pastures, why can't you make Nigeria a greener pastures for these people? Secondly, the medical tourism, you have people, just like you said, we have these leaders who are even discussing this bill right now. Most of them travel out to get medical attention. Why then would you not deal with that? If you were to deal with the root cause, then maybe we would not even be talking about keeping people here for 5 years. Nigerians would be willing to, stay. Doctors would be willing to stay. Now, some of the things that I got from some of my classmates is this subsidized rate that we're talking about. The quality of, yes, the education itself is different, but what they have to go through, the hostels and everything that they have to pay for, that's one. Everybody who has gone through a Nigerian university understands the stress of going through a Nigerian university. So the subsidized tuition is there, but how about all the other costs that a student has to carry on their own? Secondly, there's a number of years that you go through this medical school. Most of them do 7 years. Then after that, they do their internship. They said most of them don't get to do their housemanship immediately, their internship immediately, because there are no hospitals taking them in. Some of them stay 2-3 years waiting to get on. Then when you now get into the hospital, they work you for hours. Even my mom confirmed that. She said sometimes she feels really sad for these house masters, I think is what they call them, housemanship students, doctors. She says they use them for hours and hours. They put them on call. That sometimes it will be 2-3 days. That same doctor going back and forth. That same doctor will also need to assist with other things back and forth. That, to be honest, the doctors in Nigeria are not treated fairly, except especially the low-cadre ones. And so it seems quite unfair that having looked at all this unfairness that's happening, that you are now proposing to now keep them for 5 years, which that time that they used to go abroad is giving them an option to just find things a bit easier for them. You do not look at that. You're just looking at how to keep them down for 5 years because it satisfies your, I don't know what.
Okay, so that's one way. That's fantastic. But it's unfair on that. And also, one of the government is paying that. So who's unfair? Are we looking at? I'm just saying that there's different ways of looking at this. Because somebody who says it's unfair can also say, me that I'm also using it on my own pockets to maintain X, Y, Z, whatever. I'm just saying unfair can be shared around. Go ahead, so let me hear your thoughts on this.
If we remove the hypocrisy from the part of the government, and we remove the fact that the government also pursue medical treatment abroad, if we take that law on its face value and we don't take it from a place of distrust for government, we would be examining. The only correction would be make it more robust, not eliminate it. The correction will be, let us make this law more robust. It's like when we were talking about our social media law that time, that, oh no, everybody went against it. But now realizing we should have had a social media law. The reason we went against it was because we were dealing with the person and our lack of trust for the persons that were going to create that law without taking the law at face value. Who will benefit if more doctors stay in Nigeria? It's not the politicians. They don't lack doctors. They can travel. They can pay for good healthcare. The real beneficiaries, if we have more doctors staying here, are the average citizens of Nigeria. So it's not a selfish law for themselves. It is a law that shows we are desperate. We need a solution. How do we keep doctors? But I feel that if we understand that the law from that perspective of these leaders are just thinking, what can we do to ensure we have more doctors on ground? Then we will be able to accept that law and help them refine it. But what I've seen is everybody just attacking the politicians. You have no right. You go abroad. You have money. You now want me that I've just escaped. My child wants to escape Nigeria, not to escape. Many doctors, as in, I know someone that before she even finished her exams, she had already prepared, like, is a month after she graduates like this. Why didn't she go and study abroad? Why? Why? Because we all know for you to get a medical degree in the US or in the UK, you are paying you will spend the next 10, 15 years of your life paying back student loan. So Nigeria, yes, are subsidized for many people, but we have a medical crisis. Are we taking cognizance of the fact that there's a medical crisis on ground and we're looking for how to solve it rather than just throwing stone and throwing the baby and the bathwater away?
All right, so we've heard different perspectives, really interesting conversation. We're still discussing this proposed bill for Nigerian doctors who are trained here to stay back for 5 years before they can therefore be allowed to go abroad. We're going to be opening our phone lines. You can call us on 081-270-53687, 091-390-76948. You can also tweet to us at TVC Connect. Please hashtag YourViewTVC so we can read your tweets. We have a few comments. I have one here from engineer Ajibola Tijani, PhD. He says, good day, Murayo. So to put this unfortunate situation in order, it has to start somewhere in order of priority. Doctors are given priority at the NYSC orientation camp, unlike other graduates, and their demands for welfare is always on the front burner compared to other professionals. Have you ever heard that engineers are planning to go on strike? Are the engineers well paid and their welfare taken care of? In fact, there is no inexperienced engineers that would embark on a JAPA journey because experience is key in engineering. So let us have the statistics of how many doctors, engineers, and other professionals are leaving the country in droves. And if statistics prove that engineers are in shortage, then the same plan amendment should be extended to the engineering profession. That's from Engineer Ajibola Tijani. Thank you for your comments.
Like I said, if we look at the crisis on ground and we are looking for how to address the situation, I think that our leaders, when you look at it now, it looks like the leaders are trying to punish doctors. That's the response doctors are saying, that why are you punishing us for your you've not put a system in place. You're not punishing me for trying to escape your system that is stifling me. Why are you doing that? But if we look at the problem the government is trying to deal with, which is a problem that affects every one of us that we use general hospital, we know there's a crisis on ground. We don't have enough hospitals to assimilate the doctors. We're not paying them well. The environment is unconducive. Then we look at how can the government deal with this problem in a way that will not make them feel bad, but will make them understand that this is patriotism to my country before I go and pursue my financial glory somewhere else. But let me first commit out of patriotism to the country that has giving me education. You cannot complain about it being unfair and say they should cover other areas that are also essential, but let us look at it holistically.
Let me take Dr. Ijoma from Ogudu. Good morning, Dr. Ijoma. Thanks for joining us this morning. Oh, yikes, we lost her. We'll have to get you back. We really wanted to hear her thoughts because she's a medical doctor, and it'd be great to hear her thoughts on this. Go ahead.
I wanted to say there's no stifling. If you ask me my opinion on this 5 years thing, because even if the doctors graduate, 5 years is a period of time to gain experience. And, to be highly priced anywhere in the world, experience will come into play. I remember my own family doctor who's been here forever, still a doctor practicing in Nigeria and has built his own hospital. He said, once I had an accident and they needed to almost cut off my last toe. And he was saying, when he was treating me, he was saying, when I trained, I was sent to the north. That, until you are complaining about spirit, that some wounds that they treated, they did not have the implements to do. They just, they just did it. And that he saw patients survive. Sometimes it's those germs that I'm screaming about that will cut off my toe, that would even aid healing. So I'm just thinking, the experience he gathered in that hard condition was something that helped him into he's in his 60s now, into who he was by the time I met him, and he was sharing some of those experiences with me. 5 years to stay back in Nigeria and practice is a period to gain experience. All right. Really no punishment.
Let me take Dr. Ijoma. She's back. Good morning, Dr. Ijoma. Are you there?
Yes, I am. Good morning.
Thanks for joining us. We would like to hear your thoughts because, lots of doctors have been on various sides on this. What are your thoughts on this proposed bill?
Okay, my views on this. it's unclear how they plan to implement this. Because when they say qualified doctors, according to the MDCN Act, that's Medical and Dental Council Act, an unqualified doctor cannot practice unsupervised. So you're given a provisional license for 1 year doing your house job when you have to work supervised, by a senior person. After which you get a license that enables you to go for your NYSC. So are they trying to say that people would spend 5 years and be compelled to work under supervision before they can go for NYSC? Are they going to extend that period? Because, if they are not going to do that, then that means the person does not get that license to practice. So that's what I'm saying, it's unclear. Now, if you need people to work under supervision, where? Because even the 1 year house job, people have difficulties. The country cannot absorb all the doctors that graduate to even do their house job as we speak. Some people have to wait 2 years or so before they get a place to do their house job. So that's another challenge. So it's not clear how they plan to implement this. And it's not just the doctors that are leaving. So it doesn't apply to all the members of the health sector. You have the doctors, the nurses, the laboratory scientists, the pharmacists. These are all people in the health sector that are in high demand. And like I was saying earlier in a different fora, that the nurses are even the highest in demand of all the groups because it's easier for them to move than the doctors. So why particular focus on the doctors?
Well,
and then
go ahead,
and then the medical NIMSA, one letter that they wrote, not everybody is subsidized in their training. The subsidized people are those that go to public universities. Those that go to private universities are paying 9 million and 10 million and those kinds of things to get the medical training. Would you still also impose this on them? Because they have also paid their dues. Their parents have paid their dues to get them trained.
Thank you very much, Dr. Ijoma. Dr. These are valid positions you put out here. Yeah, so private universities are there. The possibility that the details, we don't know about the details here concerning what you said about the supervision. It could be 1 year, it could be 5 years. We'll get the details when the bill comes out. But let me ask you, when we look at it on all sides, some Nigerians who think this is a great idea believe that Nigeria is one of the most affordable places to have a medical degree anywhere in the world, that it is the government itself provides the facility and universities for lots of young doctors to graduate. And when they go abroad, many of them just take exams and they then begin to practice. Do you think it's fair on the government to do that? That's one. And secondly, even abroad, there's a waiting list a lot for house jobs, residency jobs, getting to hospitals, because I know a few people who are waiting to see which hospital can absorb them. They've been there many years, having to just continue to apply to various hospitals to be absorbed. So this problem of being absorbed is not just in Nigeria, don't you think?
Yeah, so if they are jobs, somebody graduates, your mate graduated 4 years earlier, you're staying 6 years in university to learn, you have to now do house job before NYSC and then you have to stay 5 more years. No. If within that period, you say 6 years, we absorb you into a training facility. By the time you're done with that period of time, you're being trained by the country, you become a specialist, you're offering that service and you're even doing it at very minimal fee. They are paying you minimally. So you're gaining that training and you're giving the service back. I'm sure a lot of people will want to stay. But lots of people come out and they cannot get jobs in places where they can further. In the US and a lot of these countries, immediately after their house job, their internship, they get a residency training placement. And it's only after that they can even start practicing. But it's not like that in Nigeria. So people write this residency entrance exam, and 7 years later, they're not able to get a placement to train or to further. And then some of them are forced to go and open their own hospitals when they've not even specialized yet and all of that. So there are issues here, and even when you're training, you don't have the facilities here. They are not paying you what they're supposed to pay you when they are supposed to pay you. Right. And you can't even excel. Even very quickly, let me even talk about healthcare financing. There's a new bill now that was passed, National Health Insurance Act and all. And if you see the payment, remunerations that go to doctors and healthcare facilities under that, it's very minuscule. minuscule. So how can people sustain healthcare on that? We need to increase healthcare spending in Nigeria in order to move towards universal healthcare coverage that we're all pushing towards. So these are things that need to be put on ground in the country. People want to stay back. A lot of these people that are living do not want to leave. I know specialists that have left. I am a specialist. I have colleagues that have left. Nobody wants to be a specialist and go for another country and start all over again because they start practicing and medicine all over again. Nobody wants to do that if things are okay here. You know, if they are safe, there's no safety. People can't take their children without being afraid of being kidnapped and all of those things. So there are so many issues that need to be put in place so that people will stay back and they will stay.
Dr. Juma, thank you so much. Really appreciate you calling.
Thank you.
Just had to speak to a doctor. Thank you so much. That was what brilliantly said. Also, our producer have been trying to reach out to the sponsor of the bill, Honorable Ganiyu Johnson, via numerous phone calls and text messages. We hope that we can get to speak to him before the end of the show, just to give us an insight. Because
why he's doing
especially because Dr. Ijoma has highlighted some details.
That you should be aware of.
Yeah, so those details, we would like to hope that the bill would accommodate and ensure, because it has to be well encompassing to ensure that even if you're going to stay about 5 years, are you going to be automatically absorbed? Are they going to ensure that there'll be hospitals to take you in to work for 5 years at remuneration? So those are things that, these are details that we need to find out.
There was a public hearing. I didn't hear of a public hearing. We just started hearing.
Yes.
So I hope that there will be a public hearing, well notified one, so that all the players will be able to come and highlight issues.
Great. So I think we're going to be wrapping up on that. I mean, our guest is here. But on this matter, any more comments on social media before we wrap up on this?
We have one that is a bit lengthy.
Go ahead.
It says, on paper, it's a good policy for national development. Note that the UK recently restricted recruitment of Nigerian healthcare workers based on the WHO examination on the brain drain. However, before you place a restriction, you can either sign a partnership agreement with the beneficiaries, that is the counterpart countries, example UK. In fact, this can be done in such a way where agreement covers a portion of the subsidized fees they benefited to be paid back to Nigeria. Several countries place restrictions on their citizens even when they go abroad to study, and they must return home. Examples are Indonesia and China, and they can sign up an agreement that their national insurance number for UK, as an example, and the NIN to be connected, so it can automatically be deducted via the foreign minister.
So there are different ways of getting this done. So
that was from a debate.
Yeah, Emmanuel says what is being referred to as subsidy here is simply paying dirt cheap for terribly poor service. Compare the quality of medical training obtainable in the US and the UK with the badly battered decrepit system here before comparing the costs.
They still get jobs abroad.
I don't see where the subsidy is what he's saying.
About that. But the person that you condemn what you get here, well, it's that same foundation that allows you get something abroad, and then you still condemn it here. So we can come back with two sides of our mouth. It's just unfortunate. Anyway, that's all we can take on this. But we'd still like to hear people's views on this. We're going to keep talking about it because the bill is still being discussed. Just like you said, hopefully there's a public hearing soon, and we can debate and look at all sides of this. But in our perspective, we must ensure that what Tokwe said is extremely, extremely profound. At the end of the day, who's going to benefit? Is it the politicians that are debating this, or you and I who are going to go to the hospital tomorrow and see if there's going to be a doctor available to treat our children?
So that's the real crux of it. Children are also
So we also need to ensure, yes, so we can debate that, but we are going to be the most beneficiaries of this, and we need to ensure that whatever we do is going to be for the interest of the greater good.